Impacts of cocaine on dopamine, a presentation by Grace, Anna, Emily, Dulce, and Claudia. As seen on this slide, we have an image of the chemical structure of cocaine. Within the structure of cocaine, there are a few functional groups that can be recognized. First, in the two red circles, there are esters. Esters are functional groups that are made up of a carbon bonded to an R group, an oxygen, and double bonded to another oxygen. If you look to the right of that, there is a purple square indicating an aromatic functional group, and in this case, a benzene ring. The ring is created by alternating single and double bonds between each carbon. Lastly, on the far left of the molecule, there is a blue triangle indicating the functional group called an amine. This is a tertiary amine because it is bonded to 3 R groups.
How cocaine works in the body. Once cocaine gets in the brain, it binds to the dopamine reuptake transporters on the presynaptic membranes as shown on the top of the image. This binding inhibits the reuptake or removal of dopamine from the synaptic cleft, which is the space between the two membranes, and the breakdown of dopamine by monoamine oxidase in the nerve terminal. As a result of this, dopamine remains in the synaptic cleft and is free to bind to its receptors on the postsynaptic membrane, producing excessive nerve impulses. This increased activation of the dopamine reward pathway leads to the feeling of euphoria and a high associated with cocaine use.
Cocaine's effect on the population. As shown by the graph on the right, cocaine use is the highest among those of ages 16 through 24. In 2019, 11.4% of those ages 18 through 24 have used it in the past year. Cocaine use is responsible for about half of drug-related emergency visits. The use of cocaine is also responsible for an increased risk of HIV and other transmittable diseases. The use of cocaine is often associated with family instability and can cause a huge economic burden for users.
Like we said before, there's recent research that suggests that intermittent use of cocaine and longer periods of not having it can actually increase the effect of cocaine because it increases the dopamine release and inhibits the uptake. So there's an increased impact on the brain's pleasure center. So as you can see in figure 1, the control had the lowest DA release and the Vmax, and then 7 days off had the highest in both cases. So then building off of that, in figure 2, you can see that at very low levels, the dopamine response is not significantly different between the abstinence intervals, but the increased dopamine response rises dramatically as abstinence interval increases at higher cocaine levels. So you can see the curves, they increase drastically for that top black one, whereas the blue one's a little bit less at 30 UMs of cocaine, and then obviously the red and the black or the solid black is pretty low. And so these two diagrams suggest that abstinence alters presynaptic dopamine system kinetics in ways that result in increased highs, and so that's going to alter the impact of cocaine and lead to later addiction, because the longer you go without it, the greater the high is going to be, which means that you're going to want that drug even more.
As future nurses, it's essential that we understand the potential situations we'll have to deal with in the near future. Cocaine and other drug use is extremely prevalent in the U.S., so it is very important that we understand how cocaine works and how it affects the brain. Because cocaine is responsible for 50% of drug-related visits to the emergency departments, we must understand how to treat patients correctly. Here are our exam questions. Number 1, what are the 3 common neurotransmitters that are built up in the synaptic cleft as a result of cocaine use? Number 2, how does cocaine use affect dopamine production in the brain? Exam question answers. For number 1, the 3 neurotransmitters are dopamine, serotonin, and norepinephrine. For number 2, how does cocaine use affect dopamine production in the brain? There's research that suggests that cocaine use can increase dopamine production when the drug's being used.